Hello, Emma. I'm Dermot Smith, the consultant. Do you want to take a seat there?
Yeah, yeah,
You were diagnosed with type 1 diabetes recently, Emma,
yeah.
and you have a few questions about that.
Yeah.
And what can we,
I
what
just,
questions are they?
uh, I just want, am I going to have to keep going? I mean, what exactly is that? I'm not sure
Okay,
what
yeah,
type 1 diet,
yeah.
what's that like?
Well, it's very important for you to realise, unfortunately, type 1 diabetes doesn't go away. Now, you got type 1
Because
diabetes.
it's really a pain,
I
you
can
know?
appreciate that, yeah, but in type 1
Very awkward.
diabetes, it's nothing that you've done that brought this on. Now, there's a little organ in your body called the pancreas gland. And the pancreas is a little gland that sits in your tummy.
Right.
And within that gland, there are tiny little cells, and these cells produce insulin.
Mm.
And insulin is essentially a hormone that makes you feel very well. It's very important for you to have this hormone on board to make you feel well, to feel fit, and to
Yeah.
feel healthy. Now, unfortunately, in type 1 diabetes, you produce cells within your own body that destroy the cells in the pancreas that produce insulin. So I'm afraid when you were diagnosed, you weren't producing enough insulin to keep you well.
Yeah.
And if you didn't go on the treatment, you could go very sick, or
Right.
you could get very sick.
Right. I mean, this just came out of the blue, you know.
Yeah,
It's just
and I'm afraid
all
that's
it
often the
was
way.
I was just really thirsty,
Yeah,
like, and
yeah,
I was just drinking. I mean, I couldn't keep up buying Coke for
yeah.
myself,
And that's often the
and
way, I'm afraid. That's often the way with this condition.
I'm
It
going.
comes on very quickly.
I'm going to the toilet all the
Yeah.
time. Oh,
And that thirst and that symptoms that you have is a reflection of your blood sugars being very, very high.
right.
And the function of insulin is to keep those blood sugars normal because one, now that you're on the insulin, you probably feel better that you're not going to the toilet as much. And that's really a sign that you need to keep
It's
the
just
insulin
really
going.
awkward. Like, you know, I work. I don't know if you know the Kyle. I work in
Yeah.
the Kylemore,
Yeah,
and I'm a waitress. Like, and
Yeah.
I have to keep ducking in. You know, 4 times a day. Like, I have to bring that yoke around with me
Yeah.
and inject myself.
yeah.
It's a horrible thing to be doing.
Now, really, our whole focus here, I'm afraid, is it's very important as well for you to accept this, that I'm afraid that insulin is the only treatment for this condition. And the only way we give insulin at the moment, per se, is with injections. And the reason why you're on the 4 injections a day is you're trying to mimic what the normal pancreas will do.
Yeah.
So the normal pancreas produces some background insulin all the time, every minute of the day, every hour of the day. And you're on 1 injection at night time called the Lantus. Now
Yeah.
that Lantus is there to mimic this background insulin. Okay?
Right. Right.
Now when you eat a meal, your blood sugar goes very high. And the Nova Rapid you're on, that insulin you take 3 times a day, is to match that rise in blood sugar when you eat food. So I know it's a nuisance, the 4 injections a day, but that's the best way to try and manage your diabetes at the moment.
Right.
Because what we're trying to do there is mimic what the normal pancreas is doing.
Yeah. The nurse said something to me the last day about keeping it something below 7 or what's that?
Yeah, and this
What's that
I'm
mean?
afraid, is the challenge of diabetes. This is the difficulty about diabetes. Because what we're trying to do is to get your blood sugars in very tight range. Ideally, before you eat a meal, your blood sugar should be between 5 and 7. If it's less than 4, then that's too low, and you could get what we call a hypo, and we'll talk about that in a second. But if it's above that, if it's high all the time, then I'm afraid over time you can get the complications of diabetes.
What are they?
Well, diabetes, I'm afraid, because this is a condition of high blood sugar, it can affect potentially it can affect your eyes, it can affect your kidneys, it can affect your nerves, and it can also have problems with circulation. It can affect the heart, increase your risk of a heart attack or a stroke.
Gee.
However, if you get your diabetes well controlled, then our aim is to prevent any of these complications happening.
And how do you do that? How do you?
And this is all about the injections and the testing. Now, the important thing, Emma, was when you were diagnosed with diabetes, you have no complications. So you have a clean slate. You have no complications of diabetes at the moment. And our aim is to try and prevent that from happening in the future.
Yeah, yeah.
And if we can keep your blood sugars well controlled, then our hope is that you won't develop these complications.
That's really awkward. That's
Oh,
that blooming that prick test, isn't it? You have to keep.
yeah.
That's a real pain.
Yeah. But the important thing, Emma, is that these tests are there for you. They're there for you to help manage your diabetes. and for you to put yourself in the best chance possible to prevent these complications from occurring. And there's good evidence now that people with type 1 diabetes are living longer than non-diabetics if they can look after themselves. And that's really our aim for the future. Not just now, not just next year, not 5 years, 10 years, but forever. But the first step to do that is to accept that you have this disease. It is treatable. We can prevent the complications from happening. But it's really to manage your injections well, test your blood sugars frequently, and try and get your blood sugars as well controlled as possible. And that's our aim. Before a meal, 5 to 7, not higher than that, and less than 4 is too low.
I just find it really awkward. Like, I mean, I have 3 kids, you know.
Yeah.
They're 12, 10 and
Yeah.
6. And I mean, we like to have a cake after our dinner every day, like, you know, and you know, it's a few times there I didn't, and my husband went mad, like.
Yeah, no, I can
I
understand
mean, he
that.
said this bloody pain, you know, and I can understand as well, you know, because suddenly you open the presses and there's no
Yeah.
goodies. The kids are going mad as well, like.
Yeah. And
Can't
that's,
keep that
that's
up, but because I really like sweet things, you know.
Yeah.
I've always had a sweet tooth.
Yeah.
Suddenly, it's miserable. You feel like it's Lent all the way year
But
round.
I think that's an important point, Emma, because what we would like you to get to do is if you keep testing and get comfortable with your insulin injections and how the insulin works,
Yeah.
it's very important that we get you to a stage where you're in control of your diabetes and diabetes is not in control of you. And what we would like to do over the next few months with the help of the nurses and the other educators is that if you wanted that treat, you can have that treat, but you need to take a little more insulin to control your blood sugars.
More? I'd have to take more?
Yeah.
Inject
No,
more?
just an extra amount on your dose. So let's say you're sitting down for your dinner, and let's say you normally take 4 units of your Nova Rapid. Okay? Let's say for that dinner you want to have a bit of ice cream after dinner. What we would say to you, instead of taking 4, maybe you should take 6 units of Nova Rapid. So you can have that treat. It's all about getting the blood sugar down.
So I could do
So
that.
you can adjust your insulin to accommodate maybe a change in the carbohydrate. A bit more carbohydrate, you could take a little bit more insulin.
So I don't have to really kind of check, you know, because I have like a shopping list that I do every week.
Yeah, and I can appreciate that that's very restrictive. If you go down that path, that can be very restrictive. And what we would maybe get you to do is speak to our dietitian who will advise you on how to carbohydrate count. So therefore, when you sit down and have a meal, you can sort of estimate how much carbohydrate is on the plate, and you can match the amount of insulin to that carbohydrate. And that gives you more flexibility.
Very
It's hard,
confusing,
Emma.
isn't it?
And I know sometimes early on in the diagnosis, it's a frustration that you'll never get there, that you'll never take this on board. But you will. It is very important to remember that you will. And it's also very important to remember that it is important to take on these messages, because if you learn them now, you can apply these for the next 5, 10, 15, 20 years.
And you don't think...
And you can do that, you can achieve that.
Right. And you don't think I could go off these
I'm afraid not. The way you were diagnosed, Emma, I'm afraid in you're not producing any insulin yourself. And if you stopped your insulin, this is very important, you should never stop your insulin. Even if you're vomiting
What
or
would happen,
feeling
like,
sick.
if I did?
If you stopped your insulin, you could actually present as an emergency to hospital. It could actually be sort of what we call a ketoacidosis. That's a medical emergency where your body is deficient in insulin and you get a breakdown of acid in the body, and that can be extremely serious.
Really?
So, and this is why the insulin is important. But the bottom line, Emma, is to remember that you can manage very well with this, and that if you look after your diabetes with the injections, with the blood testing, matching your insulin to what you're eating, that you can prevent any of the complications that you hear about diabetes. That is achievable.
Right. Right. Okay, so you think it could be okay? Just...
Yeah, it's a huge shock to your system. When you're 32 and everything's going very well and you've got 3 children and all of a sudden you're told you're diabetic.
It's a pressure on my relationship as well, you know, with my husband. Like,
it's a change in your life, absolutely.
He can't really adjust to it at all.
Yeah.
Like.
Yeah. I know it's a huge change in your life because you've been managing very well before that.
Yeah.
But the reality is, and it's important for your husband to realise that this treatment is there for you. It's nothing that you've done that's brought on this. This just happened. It's just one of those things, I'm afraid. But it's important for you and your husband to realise that the treatment is essential. that it is a change in your life, it is a change to some of your diet, it is a change to healthier living, but that can be actually quite beneficial. The injections are a nuisance and the blood testing is a nuisance.
Yeah.
But if you use that information positively, you can do very well with the disease and manage very well.
Okay.
Okay, Emma. So we'll see you again in a few months' time.
Okay, doctor.
All right.
Thanks
nice
very
to meet
much.
you. All
Thanks
right, and all
very
the
much.
best. Okay.
Appreciate that now.
Bye-bye now.
Okay, bye-bye.